Good afternoon. This is Dr. Daniel Kaminsky with the Walla Walla County Department of Community Health. Last week, we started the conversation about Omicron, and we don't have a whole lot of new information, but we wanted to share what we knew with all of you. So I think when we spoke last week, I believe there were about 17 states that have identified Omicron. Now over 35 plus states have identified the Omicron variant. Looking at the CDC data as of December 11, this data always lags a little bit, but at that time, about 3% of the sequenced cases were the Omicron variant. The majority of the cases, 96+% nationwide, were the Delta variant. Looking at regions, there were more cases of the Omicron variant in the northeast of the country. Looking at the Pacific Northwest, we are in region 10, and that included Idaho, Oregon, and Washington. There were no cases on the CDC roster from Idaho or Oregon, and according to the CDC, 0.15% of our sequence tests were the Omicron variant. This is from the CDC data. If you look at the Washington State data, which lags even more, that was from December the 4th. They said 0.4% of our sequenced tests were the Omicron variant. We do know that the Omicron variant has shown increased transmissibility. And so in general, the case rates have doubled every 3 to 4 days. And so we saw that in South Africa and Europe, where the cases really rose very rapidly. I did review some reports today that monoclonal antibody treatment is likely not effective for the Omicron variant. There have also been a lot of questions about the severity of illness, and some data suggests that the illness may be less severe, but we don't have a lot of data. So it's really too early to tell if this is a less severe illness, but there have been studies looking at neutralizing antibodies in people who have had prior infections with the alpha, beta, or delta variant, and having prior infection with those variants does not seem to be protective necessarily from the Omicron variant. But if you had past infection and got vaccinated, there does seem to be enhanced antibody protection. Likewise, if you get your full vaccine series and get boosted, there does seem to be some protection with that as well. And just a reminder that all vaccines and boosters, all this is not perfect. Vaccines don't prevent you 100% from getting the illness, but it definitely decreases your risk of getting the illness. It also doesn't decrease your chances of spreading it to someone else if you get it and you're vaccinated, but it decreases the risk of that as well. You shed less virus for a shorter duration of time. But it is pretty clear that vaccines and boosters do decrease the risk of severe illness, hospitalization, and death with the Delta and the Omicron variants. So, our current situation in the United States, but also in Washington State, we're still dealing with predominantly the Delta strain. We are seeing cases tick up a little bit this week, and certainly across the country they're ticking up, and this seems to be mostly related to the Delta variant. That Omicron variant, the numbers will likely double every 3 to 4 days, so we'll see more and more of an impact on that over time. And the concerning thing with that is that the rapid rise in cases, even if it predominantly causes mild disease, there are still going to be individuals that have to access the healthcare system and the hospitals. And so if it's spreading rapidly, we still could see a surge in our hospital system. So it's important to continue to be careful, maintain your vaccination status, get your boosters, get vaccinated if you haven't gotten vaccinated. So in summary, we have all the tools to fight this. We have the tools to fight Delta. We have the tools to fight Omicron. We will learn more over time. And we only have so many tools in the tool shed. So let's use what we have, get vaccinated. If you haven't already, get your boosters if you haven't done that yet, and continue with the other mitigation measures. So stay safe, and we will see if we have any more information to deliver. We'll try to get back to you next week. So take care of yourselves.